bullets have ricocheted onto their property, damaging planes and other equipment. Residents are also reporting stray bullets hitting their homes and the bullet casings located in the area just a couple hundred feet from their homes. The county is exploring options within its authority to help reduce risk and protect residents in that area. We're going to have more on this story tonight at 10. A new state directive could soon change what some Texas roadways look like. Governor Greg Abbott is asking the Texas Department of Transportation to make sure all roadway markings follow federal safety standards, and that includes removing any designs or symbols that don't. TxDOT has sent letters to cities and counties across Texas, giving them 30 days to identify and remove any decorative or symbolic markings that don't meet federal guidelines. And the El Paso Children's Hospital has closed the book on their latest fiscal year, a year that's been highlighted by the opening of a new 8th floor, 26 new pediatric rooms that feature an intermediate care unit and an epilepsy monitoring unit to address critical regional needs, among several other key growth items. And joining us now is Cindy Stout, President and CEO of Children's Hospital. Ms. Stout, thank you so much for joining us here on the program. I know the end of a fiscal year, really a time to reflect, I'm sure, for you and your staff. We have seen tremendous growth in El Paso, and when you have a growing city, places like hospitals, they have to grow as well. So how has El Paso Children's Hospital, how have you been able to keep up with some of the growth and expansion that we have seen in the region?
Thank you, Andy. I'm glad to be here with you all. You know, El Paso Children's Hospital continues to really assess the needs of the community, especially as our population grows. We look closely at analysis and data to determine what's happening within our community. We also do what's called a community needs benefit assessment, where we look to see what are those hot topics that are affecting children and teenagers. And that's kind of how we craft what we're going to really focus on here for the hospital. And just like a number of years, this year has been a phenomenal one. We've had a lot of growth. We've been able to open up new services and add on to the hospital, as well as create more access points within the community.
And I know you touched on it right there just a little bit. Services, that's a big one, especially when it comes to caring for some of our littlest patients and ability to do that at home. What service lines have been added to keep El Paso families home while going through, I'm sure in the majority of cases, just the unimaginable with their children?
Absolutely. You know, this last year, on October 1st of 2024, we opened up the region's first epilepsy monitoring unit, where I'm proud to be here right now. And during that period of time, we have seen over 200 patients who have come through the facility that it needed some form of monitoring through our epilepsy monitoring unit. And what's interesting about it is that where we had to used to see so many kids leave the community for care, now they're able to, in partnership with our physicians at Texas Tech, as well as physicians employed through the hospital, that we're able to really take care of those children right here at home. What's interesting too is that we have a wonderful neurosurgeon in partnership with University Medical Center, and he does a phenomenal job on surgeries for epilepsy patients. But that's not the only thing that we had going on this year. We brought the region's first pediatric geneticist, and this is a physician who is especially trained to look at the genetics, the DNA, the complex makeup of the cells within the body, and help to diagnose children appropriately. We also have brought on board, in conjunction with our partners at Texas Tech, 2 new orthopedic surgeons. One of them that does complex spine surgeries, and then the other one that does complex hip surgeries. Again, bringing that level of care specifically for children here in the community. We also opened up Andy, our second urgent care center, and we continue to recruit a number of physicians as well.
Yeah, and I want to stay with the doctors, right? Because with growth becomes, as well as growth and services, comes another need. That is, of course, doctors. You mentioned some of the new doctors that you have. How have, I guess, you been able to attract some of the country's best doctors to El Paso? Has that been a challenge at all of yours?
You know, in terms of recruiting for all hospitals, quite frankly, it's a challenge. The pipeline for pediatric specialists and physicians is becoming smaller and smaller as the years go by. Part of that is because when you have physicians that are specialists, they have to go through additional training in order of taking care of children. And so with that being said, the competition is pretty strong. However, the great thing is that we have such a young hospital, being 13 years old, that so many physicians want to come and they want to help us to build programs. What's also very interesting is that they're able to take care of children right here on the border, which affords them a great opportunity for research. And so really looking at that 350-mile radius that we cover, I think that many of the physicians that we've worked with and have been able to recruit into the community, that's what they want. They want to be able to take care of diverse patient population right here on the border. So it's been very good.
And I mentioned at the top of this interview the fiscal year just ending and a time to reflect. What do some of the numbers tell you right now? And I guess what's going to emerge right now as a top priority for you going into the next fiscal year?
Right. Thank you for that. The wonderful thing about our hospital is that for many years already, we've been able to be financially stable. As you all are aware, you know, the community, we went through a bankruptcy here at El Paso Children's Hospital. We've emerged out of that. And since 2018 fiscal year, we've been in the positive. And so we continue to really grow our services and make sure appropriately that we're utilizing our resources. You know, as a not-for-profit hospital, everything that we do, even when the money is made for the hospital, we keep pumping it back over into the services. What are we looking at this year? We're going to grow our multi-specialty center. We're going to be adding in an EOS imaging system specifically for the orthopedic surgeons. We're looking at creating some other types of service lines and then also creating more access points through potentially urgent care centers and another multi-specialty center potentially here in the community.
All right, Ms. Stout, thank you so much for your time and an update over there at El Paso Children's Hospital. We certainly look forward to having you on the program again here in the future.
Thank you, Andy.
You got it. Cindy Stout, the president and CEO of El Paso Children's Hospital. And coming up, we'll tell you when the man convicted of killing his 2-year-old daughter in 2000